and celebrating a life well lived deserves the same thoughtful planning. Beacon's Rest Easy plan is designed to give your loved ones the comfort of knowing that they can do just that. With no underwriting and cover for up to 6 family members that includes certain injuries, this plan can be yours for as little as 75 cents per day. Call us at Beacon or log on to beacon.co.tt for more info today.
2 times 2 is 4. 2 times 3 is 6.
Education multiplies their chances and places the world of opportunity in their hands. No matter where they are in the world, make sure they are prepared for their journey back to school with Western Union. School fees, books, room and board, whatever the reason. Knowledge, independence, opportunity. Western Union, moving money for better.
That's right, Western Union, moving money for better. Good morning to everybody. We're inside of the ladies' room right now. Scratch Master in your company. And I have to say a special good morning to my guest. He's no stranger to the ladies' room, Dr. Bert Brathwaite. How are you doing this morning, sir?
I'm not bad. How are you?
I'm good, man. Just take it a day at a time.
That's right. Good morning to your viewers and listeners.
Yeah, I'm glad that you're sharing your knowledge and, of course, your wealth of knowledge with us this morning. Just a few questions I have for you this morning. How are you doing, though, in the midst of everything that's happening right now?
Well, to be honest with you, it's been tough. It was especially tough for me, actually, before the whole thing broke out, because I saw the writing on the wall. Because once we started to pick up a few cases, and I recognized what activities had gone on, I knew that we could be in for quite a attack. Not to the extent that we have received it, but nevertheless, I anticipated it to some extent. That doesn't make it. That hasn't made it any easier, I should say, though.
I mean, expecting something, and then when it actually happens,
yes,
it's different things there. Especially when you haven't experienced it before.
Right.
You know?
None of us would ever experienced anything of this type of magnitude. And whilst on that note, let me express a special word of condolences to the many, many, many families who would have lost loved ones and friends, etc. Just this morning, I was listening to a program on your station, and you heard of people who were fighting with the illness at home, the family members, and then they lost very good friends, including in one instance, the young lady, I think the youngest person we had on island, whose mom died from it. So it's been tough. It's been tough for everyone, but our resilience will show through, and we just have to exercise patience and do the right things.
Do the right thing. Now tell me, as the virus rages across the country, what would you say is our personal responsibility in staying safe?
Well, the number one responsibility we have is to get vaccinated. If any, what never ceases to amaze me, the more we go along, the more we get evidence of the importance of it. This morning on your program, Brenda had 3 people all attesting to the importance of vaccination. One saying, if I did not have that vaccine, I don't think I would be here today, right? That person was fully vaccinated. The other persons were not fully vaccinated, but they still had torrid times in different ways. So getting vaccinated is critical, all the evidence. And what I don't quite understand either is we have our own statistic here, which is similar. I heard the chief medical officer from St. Lucia, similar statistic, 100 people in hospital. In all cases, 100, it was pretty close on 100 people when we got that statistic last week. And 97% of the people were unvaccinated. So the overwhelming majority of people who are getting hospitalized, and 2, going on to die, are people who are unvaccinated. Indeed, and in fact, we are dealing with a pandemic basically of the unvaccinated. The pandemic is not that you won't get sick. Everyone recognizes that you can get breakthrough infections in cases, and you can get sick, but that sickness often will not take you to the hospital. You're not going to die. If you're unvaccinated, there's And if you are unvaccinated, you have risk factors like you're overweight, you are diabetic, you have some other underlying heart condition, heart failure, some even mild kidney failure, etc., autoimmune diseases, cancers, HIV, any conditions that you have like that, you are going to be at greatest risk. So therefore, your first responsibility is to go out there and get vaccinated, because we are far, once we have picked up a lot from about 20%, and it looks as though we might be able to get ultimately by the end of this whole cycle, probably a third or so of the population fully vaccinated. We know from watching other statistics. Look at the United States. United States had about 40, late 40s, early 50% fully vaccinated, and they still had quite a sweep. They were getting the rates, the deaths are coming down now, and the cases are coming down, but they were having pretty close on 3,000 deaths again. So you have to get those vaccination levels have to rise and rise significantly for us to avoid further problems.
And you see, the thing too is that some people, COVID is exposing underlying conditions that they didn't even know that they had.
That's right. That's right.
You know, some people walking around believing that they are 100% healthy, not knowing that they have a certain condition until COVID comes, and then it's like, you know, thing. But what role would you say nutrition and vitamins play in beating COVID-19?
The nutrition and vitamins are always important, and the basic tenets of healthy living are what we express. First of all, you eat healthy. You try to keep yourself in pretty good physical shape. Then you can supplement. Nothing wrong, and it's advocated. You can supplement with your vitamins. Lots of talk about zinc right now. Not overdosing, because zinc and overdose can be problems. 50 milligrams, and your vitamin D and your vitamin C. These are very useful measures to give yourself the best fighting chance. But what it will not do, what folk seem to think sometimes, well, I'm going to take my mixture of herbs and my other home remedies, and that is going to keep my immune system from me getting it. No, you're going to still face that virus. And when that virus sees you, your immune system has never seen that virus before. If you haven't had it, that is. And when it hits you, then it's unpredictable what will happen. If you're lucky, you will get away and you will have minimal symptoms. The majority of people will have some symptoms, and 5 to 10 out of every 100 people or so will have serious symptoms. Perhaps more than 10% will have serious symptoms, but at least about 5 or so percent will be hospitalized, and 1 to 2% are going to go on and die if you're not vaccinated. So yes, take your measures at home to keep yourself in good health, but do not think that there are many stories, and those stories of people who were from all appearances in the best of health, people who had been going and getting the checkups, who were keeping fit. They were sometimes they were hikers. There were people who were doing excessive exercise, and when the virus hit them, it threw them down, and it caused their death. So I know the science can't tell you whether if you're fit, you will be one of that unusual situation or not. So what's the answer? Get vaccinated. Let me say something further about vaccination. There's sometimes, even from professional people, you will be getting guidance, or you can take just your immune boosters, and that will get you through. You can take other medications, and that will get you through. I say ignore those folk. They're not leading you on the right path. The right path is for you to go there. Vaccinations have been with us now from time immemorial. This vaccination has proved to be very safe. Go there and get your vaccination. If they're not there, you go and get your vaccination. You're not being properly guided.
Yeah.
And what sometimes people say is, oh, I have diabetes, I have hypertension, I have heart failure. All the more reason. If you have these conditions, you should have been vaccinated like many months ago. Do not wait any further. Two of the stories this morning that Ms. Baptiste gave were people who were waiting. Well, they were waiting for a while, and they just had their first shot, right? So fortunately, they have recovered and they're doing well. But there are people there's stories again of people who, okay, I'm waiting to see, I ain't ready, quite ready. And when it hits you, and let me say, we will hopefully see the numbers coming down.
Yeah.
And people may start to become complacent again. They will not wear the masks effectively, etc.
Mm-hmm.
Then, if you're not being affected by the virus, you're still going to be exposed, and you're going to still be exposed, whether it's this year or next year. You're going to be exposed to that virus at sometimes just about every person.
And the thing is, you have some people that they want to get vaccinated, but they just aren't urgent with it. It's like, I'll do it, I'll take it, I'll go next week. I'll as opposed to dealing with it, in a more urgent matter. Now, seeing somebody here is asking, what are the long-term effects of COVID on the body?
Very important question. This is something that we're under many effects. It is found that in the brain, as a matter of fact, let me say that some folk are presenting to hospital with frank psychosis, like when you have someone who develops schizophrenia and their whole thought process is disturbed, and they can become aggressive. The link with reality is gone. They're presenting like that. Some people are presenting with fits, epilepsy, right?
Wow.
So this virus is causing an encephalitis. It's causing inflammation in the brain. And for some of those people who develop the epilepsy from it, there might be a little chance that they may go on to have further problems with that epilepsy down the road, whereas they didn't have it before. So brain effects. It can affect your heart, cause heart conditions, inflammation. The heart can cause heart attacks. It can cause strokes. It can cause liver dysfunction. It causes nerve disturbances, and people's ability to walk, etc., can be impaired. Obviously, if your nerves are not functioning well. Skin, a number of people presenting into hospital, the skin is hypersensitive now. That may take a good while to settle down. So there's brain fog. There's some alteration, depression. One of the ladies this morning described depression. So a whole range of mental, of brain malfunctions can occur. But just about every organ in the body can be affected in some way, because one of the things that this virus is doing is going in and causing inflammation in the blood vessels. And if it's doing that, it can affect just about everything.
All right, Dr. Brathwaite, someone is asking, and this is an important question here. If you've contracted COVID, right, and you've gotten over it, how soon after recovery can you get vaccinated?
Well, what the ministry here is advocating, which I support, is a month after you should go and get your vaccination, and then your immune system will be properly primed and hopefully for any future variants. And we should perhaps say a word about the future at some point in this discussion.
Now,
variants.
Now that we enter year 2 of this pandemic, and we obviously have community spread in Grenada, how should individuals take care of themselves at home in households where other family members are diagnosed with the virus?
Yes, no, that's a very difficult one, because if you happen to be living in a house where you sleep in your individual bedroom and you have a bathroom attached to it, but that's easy enough. You just stay in that room. You don't come out of that room. Person brings your meal, puts it by the door, and when they move away, you go and take it. And that person inside that house should still be wearing a mask. But for sure, that's not going to be the situation in the majority of cases. The majority of cases is going to be where you might be sharing a room with others. So those individuals have to leave that room and leave you isolated in that room. It becomes difficult if you only have one toilet and bath in the household.
Because everybody's situation is different.
That's right. And if you only have one toilet and bath, and obviously the person who is sick is going to need a shower, probably even more frequently, because many people will describe how they become drenched with sweats, very uncomfortable and unpleasant feelings.
Yeah.
And one of the ladies this morning described her symptoms as much worse than Chick V. And we were telling this to people before from what we were hearing, that these symptoms are going to be worse than Chick V, right? And this is exactly what Ms. Sherry described this morning. So everyone in that household must wear masks at all times. Keep on that mask. Put on, get a surgical mask like this. This is quite comfortable to wear during the day. So you put it on, you have it on, and you put it, make sure that the ridge at the top is pressed at the base of your nose. You press it right down. You stretch it out to make sure it's covering. And if you're like me, you wear glasses, you put the glasses on top of that.
Right.
And you immediately, you have reduced the chances of spread of that virus significantly.
Now, something else I want to bring up here. One of the things that we've noticed, right, is that people are calling emergency services too late and are dying soon after getting to the hospital or dying at home. When should someone notify the medical authorities for care if they suspect that they have COVID-19 or they've been diagnosed with COVID and their condition is getting worse?
Before we go, let me just finish up on the previous point.
Yeah.
We talked about bathrooms. If you have one bathroom, then if you only have one bathroom, you probably have to try and rig up something outside so that the well members of the family can have their showers outside. Of course, that only goes for your showering. Other actions in the bathroom become much more difficult. Or at least allowing a couple of hours to pass before anyone enters that bathroom space. And when they're going to the bathroom space and they say they're going to use the toilet, they have on a mask. Obviously, if they're going to shower, they have to take off their mask. So, but you leave as long an interval as can possibly before you enter the same space as the person, because that allows those viral particles which remain suspended in the air to drop. And the person who is sick, when they're going to get the shower, they shouldn't be talking and whatnot. They just go there quietly and do whatever they have to do. Now, you raise a very important point, and I would like to. I'm glad you raised it, because we think that is what is responsible for a number of our deaths. This Delta variant is a beast. We were saying that to people before, and it has come to pass here. We are not seeing anything different from what is happening in other parts of the world. You can be feeling not too bad now, and in 2 hours' time being desperate, probably sometimes within minutes, being desperate trouble. So we want people, first of all, to recognize certain things. If your body starts to suddenly feel very weak, if you suddenly start to get shortness of breath, chest pain is a common feature. Suddenly, you might have some mild chest pain, suddenly it worsens and with you short of breath. You find you can't take a deep breath. You can't talk like this for long periods. You can only talk in short sentences. You start to become a bit confused. You might not recognize it, but your relatives recognize it. If you have a relative at home who starts to become a bit confused, don't wait. Get that person to hospital. If the older the person, the quicker you're going to move them. But I do not say that if you are 40, 50, that you can wait around too long, because there are many stories of people in the 40s and 50s here who have died, who were seemingly pretty stable. Just last night I was hearing one of the district doctors describing where she went in, she stabilized a patient and left. And within hours, that person was gone. That was not an old person.
Wow.
So the transition can come right like that. That is one of the dangers about it. So any suggestion that you're getting weaker and as I said, confused, short of breath, immediately not to speak of if you start to develop fits or anything like that. you need to get into hospital. And one of the things that people will be getting is this here, which is a pulse oximeter. This pulse oximeter, you just slip your finger. You just have to make sure if you're a lady that you don't have nail polish on. And you slip your finger into it. You press the button, and you should shortly see coming up some readings which will tell my.
Yeah, I'm seeing the reading there. Yeah.
You can see you can see my oxygen sat.
Yeah, pretty much. Yeah.
Right, my oxygen sat. Sorry, I have it upside down. I
was wondering. Right. Yeah, I see it. 197.
No, it's 97. That's
97.
The program. Yeah.
Okay.
My oxygen sat is 97, and my heart rate is 63. So that's a normal oxygen sat. So this is a pulse oximeter which people will be getting in their care packages. I believe government has through PAHO will be getting in a few thousands of these. And if people don't have to wait on government, I'm not sure to what extent they're available, but presumably they are available in pharmacies, and folk can go and buy them. And something like this is not going to be overly expensive. I'm not sure what the cost is, but it's something useful to have at home in this time to be able to assess. Because if your oxygen sat, that's the figure, the 91, and in the case of this equipment, this was marked at the top. If that drops below 94 below, you head down to hospital for
immediately. Talking about heading down to hospital, what are the treatment protocols for COVID-19 patients currently?
Well, in the hospital, they are going to give you, they're going to check to see if you have pneumonia. If the evidence of pneumonia, you're going to be having a range of different antibiotics. They're going to be making sure that you're well hydrated. They're going to make sure you're well oxygenated. And let me say that the oxygen levels that you give are not, even in the normal day-to-day running hospital, when we have people coming in with pneumonias, there's much higher levels of oxygen. And sometimes that you require, and when there are 3 different levels, they give you by nasal cannula, then they can give you by another equipment that will send up the oxygen, the flow rates much higher, above 15 liters per minute. And then if that isn't working, then you may come on to the point where you had to be ventilated, but that's really bad news. So oxygen, the hospital is consuming liters upon liters of oxygen, cylinders of oxygen in a day. I think over 100 cylinders are being used at each hospital in one day. And the Ministry of Health has worked with L&M, and we need to say thanks to them to try to make sure we have a steady supply out there on the world market. It is not an easy item to procure, but they're trying their best to have all the reserves that are necessary here to see us through this crisis. So oxygen will be necessary. Then they will also put you in certain postures. They will want you to sleep lying on your belly, because the majority of your chest of your lung is to the back. And if you're lying on your back, it tends to be compressed. Whereas if you're lying on your belly, it gives it greater chance for expansion.
Okay.
Yeah. So
even the sleeping position is taken into consideration.
That's going to be taken into consideration. Then as well, they're going to give steroids will often be exhibited when you come into hospital. Steroids. Our government is now in the process of trying to get in some. It's the Ministry of Health trying to get in some monoclonal antibodies. Monoclonal antibodies are really for you when you first get ill, if you are a high, and probably the protocol for it will have to be worked out. I don't have the details of that as we speak, but it will be given to high-risk patients, people who have diabetes, people with underlying problems like past cancers, people who are on chemotherapy, drugs, people who have autoimmune disease, people who have HIV. All of these people, high risk people who should have been vaccinated. And I want to stress that the more the risk factors, the earlier you should be. If you're asthmatic, you should be long vaccinated. So those are some of the measures that they take in the hospital to try to see you through.
Now, in your professional experience, why do you think there's so much misinformation with regards to getting vaccinated?
I don't know. And unfortunately, some of it is perpetuated by professional people. In some instances, I think even somebody in my own profession, yeah, I can say that. When you look globally, there are people in my profession. I'm a senator. Listen, there's a way you do things. There are studies that are conducted on any medication before that medication is used. You go in and you try with a group of people, you give that medication to them, and another group, they would not have that medication. And there are various other measures you take to make sure that you're doing a scientific study. At the end of the day, you'll be able to detect, have those people who receive that line of treatment, including that medication, has it worked or not? We have to wait until those studies are completed before you can go and administer medications to people that can have other side effects.
Right.
What the modern day media has allowed is I can go on Facebook, on YouTube, and say, I am Dr. So-and-so, and so I was at X and X institute. I can probably even create an institute. Right? And then blast and tell you, oh, this is the way to go. And some of the videos are slick. They are really well done. I've sat down and listened.
They are well produced, bro.
Well produced, well thought out. And let me say something. I need to say this. People are critical of the big farm, as they call it, big pharma, and referring to the pharmaceutical companies. Yes, I don't dispute for 1 minute that big pharmaceutical companies go there and they push things that are something to do are responsible for unethical practices, and they're in the business to make money. That is clear.
Yes, so it is a business, huh?
Right, it is a business, but in the midst of that's why you have checks and balances, and that is why any drug that they produce, you have bodies around the world. It's not only USA, in Canada and Europe, stringent bodies with people who are well schooled in what to look for. They know all the ploys that companies can get up to try to get a drug on the market before it is ready. So these drugs or vaccines have to go through this process, and all the vaccines went through this process. But what I want to say is, whilst on the one hand you have big pharma that can get up to disreputable practices, you also have the alternative lines of medicine. It's $1 billion industry too. So when people tell you take this portion and that concoction and whatnot, often produced by farmers, by companies, not the so-called big farm, but they're produced by companies still.
Right.
And those companies and those people into that alternative line of business, they make a killing, right? So however you look at it, whether it is big farm or whether it's alternative thing telling you to use, and what the alternative folk would tell you to do is mix it in with some herbs and what make it look natural. But behind that is a big mega dollar business, right? And so whichever way you look at it is harmful. You know what people need to do? People need to look at these things that are a little less glitzy. And I'm critical of some of the international organizations. I think they need to look carefully at their marketing departments, because they have the resources and they can tweak their operations in a way that they too are producing these slick videos, but in this case, slick videos with authentic information.
Right.
So people want information to go to WHO, to go to CDC, to go to European and Disease Control Unit, to go to Canadian unit. Australia has similar bodies. Go to authentic agencies in the countries that are not necessarily ministries of health. These are often independent individuals in them who assess situations, assess drugs. That's where you go to get your information for. How many people that send around all these videos have taken the time to go to CDC or go to a university, any of the reputable universities in the world, the John Hopkins, the New England Journal of Medicine, that is, I forget the university that is associated with Mount Sinai Hospital. All of these big universities have websites that speak much the same language. So you got a well-established hospital, go to the website, a well-established agency that is not associated with, as I said, that has an international reputation.
Right.
That's where you go to get your information. Don't go on the video that I send you that said that Dr. Sone's one of the guests this morning on Brenda's program mentioned Dr. Dog or whatever, all kinds of things that people produce and put out there. And
I'll tell you something else. But at this point, are you encouraged by the vaccine uptake seen in recent weeks since the outbreak here in Grenada?
Yes, I am. Because we've moved from somewhere probably about 25,000 people with the first dose out there around, and we moved up. We moved up a good few thousands. I don't have the exact figure, but we're probably somewhere like 33,000 now. And if we have 33,000 with the first vaccine, we can anticipate at least 31,000 of those individuals will come and be fully vaccinated. And that would be our coverage, because the coverage is based on the number of people who are fully vaccinated. When you only have one shot, you're only about 30 to 40% covered for most of the vaccines. So, and all credit to the many folk who have volunteered and come out and given service over the weekends and during the weeks.
We've had a lot of volunteers come out. Kudos.
All credit to these are the type of people who make the country. And as I talk about that, I want to really make a big shout out to the folk who work in the COVID units, and to both the medical team, the nursing team, the technical people behind the scene, the folk who will be supplying the oxygen, the maintenance crews. Similarly, in a similar way, to shout out the nurses in the community. They have had it tougher than anyone, because they have been going at it all year round with swabbing and testing and giving vaccinations, and it's tough on them. The manpower limitations, but they have stuck to it, and they're providing the very best. So really, that's been one of the most heartwarming aspects of this whole thing, that has brought out the best. When you have crises like this, when people step up to the plate, those who step up to the plate, I should say, it comes because it's brought out the best in them.
All right, Dr. Brathwaite, just about two more questions. Do you foresee another wave of COVID-19 hitting Grenada?
That is a real possibility. When you have, I suspect we will level off at about somewhere around a third of the population vaccinated. Pretty close to that, somewhere in the mid-30s there around. We also would have had a number of people. We would have had probably another third who would have been exposed and who would have had the virus. But let me say something about that. There's a state in Brazil called Manaus, and we must learn from these type of experiences. Mid last year, they had, or the first quarter there, they had a tremendous wave, and it was thought that the overwhelming majority of the community had been affected, probably in the 70-80% range. Come December, January, bang, another wave. So that natural immunity that they got was not enough to take them through. If if Delta is the last major variant we face, well, we won't be too bad. But
Yeah.
if other variants come up, or if Delta in some way, well, that then will be another variant, changes in some significant ways and becomes another variant, we will still be at risk. If you've been vaccinated, you will still start off with you would have had a head start, as it were, if you're vaccinated.
Yeah.
If you'd had the virus and been vaccinated, that would have boosted your immune system maximally. So if your immune system, if my army has been trained, that's what we're doing. We're training the army of cells behind in the immune system, what we call the T cells and B cells, to be ready to fight. So if I get exposed to the virus tomorrow, immediately my cells should be saying, "I've seen you. I'm going after you."
It's kind of like when you put up a surveillance system for your house.
That's right. I've seen you. I'm going for you. I want to knock you out before you can knock me out.
Right.
If I don't have that haven't been exposed to that virus, the same thing won't apply. Now, how long the immunity lasts when you get it naturally, that's still a gray area. And that's why we advocate that people still go out and get vaccinated. I know that people I've talked to say, well, I got the bug and I'm not vaccinated. But I know people who had the virus naturally and who came down with a further strain. This was from way up this year, probably were exposed to another strain. I actually got sicker the second time around than the first.
Because not because you got over it the first time without being vaccinated mean you're going to be that lucky that if it is you get it a second time.
Right, and that second time would most likely be via another strain or another variant of the virus. So we don't know. No one can say exactly how long. I have sensed at times that the medical world is a bit worried as to new, but as a matter of fact, they've said it, as to new variants coming along. Whether that will happen or not, only time will tell. But if you see there's another variant and you see it starting to get going, be prepared for further onslaught.
All right, Dr. Brathwaite, thanks very much for joining us this morning inside of the ladies' room and the wealth of information that you've shared. Someone said that they like the analogy with regards to the cells and so on and so forth with regards to being vaccinated and your cells being able to detect, the virus coming in as opposed to not being vaccinated.
Yeah, but it's a war. It's a war. Thanks for so. And what you do in a war, you get your army ready.
Yep. Have to get ready.
It's in our hands. It's in our hands.
It's definitely in our hands, and we do have the vaccine and encourage people to go and
we have choices of vaccine too.
And that's the thing. At first, we started off with one. No, we have.
When I got vaccinated, it was just AstraZeneca.
Yep.
Right?
Yep. Now you have Pfizer.
Which is a good vaccine. In its own right. Yeah.
It is. Yeah. All right. Thanks very much for joining us this morning on Power 95, sir.
It's been my pleasure. Thanks.
Okay, that was
I wish all those who are not well, I wish you much better. Be aware of the sudden changes that can occur, and I hope you'll be back up on the rungs shortly. Thanks for having me.
All right, not a problem. Stay safe. That was Dr. Bert Brathwaite on Power 95 inside of the ladies' room today. Stick around. We got a whole lot more coming up for you inside